Okay, hi, I'm Lisa Williams. I'm the Executive Director of the SEIU Healthcare Pennsylvania Training and Education Fund. I am going to be talking about our project on labor management, quality, and process improvement in skilled nursing facilities. So we've been doing quality improvement committee team training and coaching since 2010 in hospital settings, primarily with RNs, but now with everybody in all the different job classifications in the hospital. But we hadn't been able to demonstrate the model in a skilled nursing facility until we got a grant from the Federal Mediation and Conciliation Service to do a project. And so our goal with the project was to demonstrate that this model would provide enough positive results, both in improved quality and reduced waste and reduced cost, that it would be compelling enough for the company to continue this model after the grant was over. The main thing was to include frontline workers in the process of quality improvement, because most of the teams that currently existed in the skilled nursing facilities did not include frontline workers. So our model was about creating the committees, training the committees, and then coaching the committees over the period of a year. Each team did multiple projects throughout the year. Here's 3 examples. One was they were looking at supplies. So they did a process of looking at their supply room and why they were having a problem with supplies and having the right supplies when they needed it and at the time they needed it. So they did a 5S, which is a lean process improvement tool to work on that, and the results are, they've been able to keep their par levels up. In this facility, the example is about handoffs. And so they worked on making sure that the CNAs and the RNs and LPNs were getting the information they needed to take the best care of residents. And they went through a process that involved the whole facility in getting feedback and making that change. The final facility example is about reducing over-the-counter medications and reducing med pass times and reducing cost. That had really measurable results in terms of cost savings and more time for the nurses with the patients or residents. We did do an independent analysis by Dr. Nick Castle at the University of Pittsburgh. His overall opinion was that it was positive, and mostly said he could say that it was positive in the effect on labor management relations, but he couldn't say that this at this time was positive on quality because we just didn't have enough time. But he said it was positive overall, and that facilitation is essential to making this kind of process work. QAPI committees in skilled nursing facilities. So we've just launched with 3 more teams. Our corporate partner, Guardian Elder Care, is totally 100% behind this, and we're just excited to see this model spread throughout the industry.